Hi again, it's Dr. Jamnadas from Cardiovascular Interventions, and today we're going to cover a very important topic, which is high blood pressure. It's important because there's an epidemic of high blood pressure going on, and there's a lot of misunderstanding about what high blood pressure is. And yet, if there's one thing that you want to really control is high blood pressure, because it can cause heart attacks, atherosclerosis, strokes, blindness, peripheral vascular disease, kidney failure. So high blood pressure is very important, and it's totally misunderstood. So as a cardiologist, I see patients with high blood pressure, but they already have end organ damage. So today I want to tell you what the incomplete workup of high blood pressure is. Traditionally, when patients come to see us for high blood pressure, we say that, 95% of them are primary essential hypertension. Well, over the years, I've realized there's nothing essential about high blood pressure. You don't have to have it. And the 5% have a secondary cause, such as kidney failure or some sort of a tumor in the body. But majority of them don't seem to have a cause for it. And therefore, the next thing is we take out the prescription pad and we give you blood pressure medications. And that's right, we do want to get the blood pressure down, and you do want to get on medications now, early, before you start developing end organ damage. But the incomplete examination, I want you to think about the things that I'm going to tell you next. Over the years, I've realized that many patients actually can reverse their high blood pressure, unlike what I was taught in medical school, that essential hypertension is just essential. So the number one thing I've realized is that metabolic syndrome causes high blood pressure. If you reverse metabolic syndrome, high blood pressure goes away. What is metabolic syndrome? Metabolic syndrome is a cluster of high blood pressure, you have a low HDL, a high triglyceride, you're overweight, your body mass index is over 25, and particularly most of the mass is around the belly. And if you look around, there's a lot of people with this condition. Look, right now, more than 50% of our population is overweight, frankly obese. It is a symptom of metabolic disease. Now, not all obese patients or overweight patients have metabolic syndrome. We know that. 80% of the patients who are overweight have metabolic syndrome. But being overweight is only a symptom of metabolic syndrome, because there are 20% of the patients who actually have metabolic syndrome, but they're actually not overweight. And we call them TOFIs, thin on the outside but fat on the inside. They have a metabolic condition in their body that is actually causing them to have high blood pressure, lipid abnormalities, fatty liver, high insulin levels. So this metabolic condition, this underlying metabolic syndrome, can cause obesity, because when you have high insulin levels, you're going to get obesity. So how is high blood pressure happening in patients with metabolic syndrome, whether they're obese or not? What's happening is that it's the insulin. Insulin really paralyzes the arteries and the arterioles, so they don't appropriately vasodilate. So when you have high insulin levels due to a condition called insulin resistance, which is part of metabolic syndrome and the problem with your metabolism, you get high blood pressure. And over the last 10 years that I've been actually treating metabolic syndrome aggressively in my office here, and we reversed metabolic syndrome through a diet, exercise, and weight loss, and changing to non-processed, non-refined foods, nothing artificial, I'm finding that the metabolic condition gets better, blood pressure gets better, and the weight automatically comes down. Now, when the weight comes down, it's not because of caloric restriction. It's because the metabolic syndrome and the high insulin levels and all the other hormonal imbalances are getting better. And when your insulin level comes down, your weight comes down. So it's losing weight is not all about calories. The calorie theory is totally debunked. It's not the calories in, calories out, and eat less and exercise more. That's all out of the window, and we know that. That's been debunked for years, but yet most people, unfortunately, still go by that paradigm, which is a totally wrong paradigm. It's the hormonal imbalances that are causing metabolic syndrome and causing your high blood pressure. So if you have high blood pressure, you can't just stop at saying, okay, I'm going to take these pills now. No, you need to make sure you don't have metabolic syndrome. You need to make sure you don't have sleep apnea, which goes along with, of course, being obese, but sometimes non-obese patients can also have sleep apnea. You need to make sure, of course, there's no kidney problems and any congenital problems that you may have. And other causes, there are some very rare causes of hypertension too. But a complete workup includes your metabolic workup. So unless you know your insulin levels, unless you really know your inflammatory markers in your body, your triglyceride and your HDL and the ratio of triglyceride to HDL, unless you know these in your blood tests, you're not going to know what's driving your high blood pressure. So I've taken hundreds of patients off antihypertensive therapy by addressing metabolic syndrome. How do we address it? How do we treat it? It's through diet mostly. It's through diet and lifestyle changes. So it's eating non-processed foods, non-refined products, no artificial things, nothing that's processed, and eating whole foods only. And then the second part of it is I do intermittent fasting and time-restricted feeding in the office because that restores insulin sensitivity. And there's some videos which are already linked to this one on how to reverse diabetes and insulin resistance through diet and intermittent fasting. So you can look at those, but that is one of the most powerful things you can do to restore insulin sensitivity. When insulin sensitivity comes back again, your insulin levels come down. As the insulin levels come down, your blood pressure gets better as well. So I hope that you found this very helpful because hypertension is not the end of the road. It means you now have the real work of finding out why you have high blood pressure and how you can reverse it. So if you like this, please hit the like button and sign up for this channel because I'm going to come up with some more videos that are going to be helpful for you in your everyday life, everyday workup, and stay healthy. Take care.